The current epidemic that we have started with the overprescribing of the pain medications in the 1990s through 2000s up to 2010, 2011, and has now progressed from prescription drugs to heroin as we've taken more of the prescription drugs off the street. And so as heroin has been used more and more, we've started to see a change. Now we're starting to see synthetic types of heroin, which is actually fentanyl. Fentanyl is actually a drug that physicians use. We use it in surgeries. It's something that we use for anesthesia. It's a very, very powerful pain medication. But what drug dealers have found is that if they can produce this medication, they can make it in a laboratory. It does not contain any kind of opium-based product. It's not based on having a poppy seed plant grow. You don't have to have transport and make quantities of opium-based product to make it. They can actually generate it in a laboratory. And it's about anywhere from, depending on talking about morphine or heroin, it's 100 to 1,000 times stronger. Whereas now we have the analogs of fentanyl, which carfentanil is one of them, and there's some others that are potentially going to be on the market that are 10,000 times stronger than morphine. These medications are extremely potent, but you can see why drug dealers would want to use these. I'm afraid that we may have seen the end of naturally occurring opiate products like heroin. They may be completely replaced with this. They can bring in a small quantity of carfentanil or fentanyl and can make a much, much larger quantity of a heroin-like product. The problem is that these people aren't chemists. They can make the medication, but it's cutting it and making it into that potency that that's the problem. They were seeing these astronomical numbers of overdoses where fentanyl or carfentanil comes into an area, and one weekend we see 20 to 25 overdose occur in one community. So that's why we've gone from where we were with the prescription drug abuse to the overdose epidemic we're seeing today.